Microcephaly and true microcephaly definition. Microcephaly, HC less than 2 standard deviation. True microcephaly, HC less than 3 SD. Causes of primary and secondary microcephaly. Primary 2. Genetic defects and familial recessive. Secondary 4. Maternal torch, alcohol, phenytoin, radiation, birth asphyxia, trauma, phenylketonuria. Genetic defects that cause primary microcephaly. 1. Trisomy 211813. 2. Cornelia de Lange syndrome. 3. Rubinstein syndrome. Phenylketonuria is caused due to deficiency of what enzyme? Phenylalanine hydroxyalase. Broad thumb toe is characteristic of which disease? Rubinstein-Taybi syndrome. Synorphes is characteristic of which disease? Cornelia de Lange syndrome. Characteristic change in urine in phenylketonuria. Mousy, musty urine odor. Causes of late onset or acquired microcephaly. 1. Rett syndrome. 2. Seckel syndrome. 3. Angelman syndrome. Rett syndrome mnemonic. Rat games. Rat. Regression of development after 1 year. G. Girl predominance, X-linked dominant. A. Ataxia autistic. M. MECP2 gene, microcephaly. E. Epilepsy. S. Speech defects, stereotypic hand movements. Etiology of microcephaly. 1. Increased fluid, hydrocephalus, hydranencephaly. 2. Thick skull, thalassemia, achondroplasia, osteopetrosis. 3. Increased brain volume, megalencephaly. Causes of megalencephaly. 1. Lysosomal disorder, Tay-Sachs, Sandhoff. 2. Leukodystrophies, Alexander's, Canavan. 3. Soto's syndrome. 4. Neurofibromatosis type 1. 5. Fragile X syndrome. 6. Familial megalencephaly. Which enzyme is deficient in Tay-Sachs and Sandhoff disease and finding in eye? Hexosaminidase A and B. Cherry red spots in macula. Fragile X syndrome mnemonic. FFMR1 gene. R. Repeat CGG. A. Autism. G. Giant brain testis. I. Intellectual deficit. L. Long face. E. Everted ear eyes. X. X-linked dominant. Abnormalities in head shape due to premature fusion of sutures is called craniosynostosis. Normal time of sutures fusion. Metopic less than 2 years. Coronal sagittal lambdoid before second decade. Premature fusion of sagittal suture causes what? Dolichocephaly or scaphocephaly. AP expansion of skull. Premature bilateral fusion of coronal sutures causes what? Brachycephaly, broad head. Premature unilateral fusion of coronal sutures causes plagiocephaly. Premature fusion of metopic sutures causes trigonocephaly. Premature fusion of multiple sutures causes oxycephaly or turicephaly. Associated genetic syndrome with craniosynostosis. Cruzon, Apert, Carpenter. Mnemonics apt Cruzon Apert and Carpenter syndrome. Autodominant or recessive Carpenter. IQ normal Cruzon or low. Head shape brachycepha in Cruzon, pterycephaly in rest. Eye changes in Cruzon exophthalmos, and hypertelorism. Finger changes Apert and Carpenter. Hypogonadism Carpenter only. Obesity Carpenter only.